Guillaume, vous pouvez commencer?
Oui, bonjour, bienvenue à cette conférence de presse. Welcome to this press conference. With us today, Mr. Howard New, Deputy Chief Public Health Officer, et Mr. Guillaume Poliquin, vice-président du Laboratoire national de microbiologie. On va commencer avec une déclaration de Monsieur New. So we have until 4:45 for questions. We will start with statements by Mr. New, and then we'll take questions. Monsieur New, c'est à vous.
Okay, merci beaucoup.
Thank you very much.
Bonjour à toutes et à tous.
Hello, everyone.
I'm here today with Dr. Guillaume Poliquin, Vice President of the National Microbiology Lab, to provide an update on our efforts to address new cases of monkeypox in Canada. Over the past week, the Public Health Agency of Canada has confirmed 25 cases of monkeypox in Quebec. Ontario has now also confirmed one case, bringing the total to 26 confirmed cases in Canada to date. We recognize that the emergence of monkeypox may be concerning to people in Canada, especially since the COVID-19 pandemic is still with us. Our understanding of the virus is still evolving, but I want to emphasize that this is a global response. We are working closely with our international, provincial, and territorial partners to keep Canadians safe. Limited cases of monkeypox have been identified in other regions of the world in the past, but never before in Canada. However, we have excellent capacity across our country to quickly detect and guide our response to emerging health security issues. Our National Microbiology Lab, or NML, is world-renowned for its scientific excellence. Currently, the NML is completing whole genome sequencing on samples of monkeypox, which will help our experts understand the chains of transmission occurring in Canada. The NML is also working actively to facilitate and support laboratory testing capacity in jurisdictions across the country. The agency is engaging with experts to finalize and release public health guidance on case identification, contact tracing, and isolation guidelines, as well as an infection and prevention control guidelines for the healthcare system. As the investigation is ongoing, additional information is still needed to determine the degree of risk for people in Canada. More information will be available in the days and weeks to come. What we do know is that there are different modes of transmission. Spread usually occurs through close contact with an infected individual's bodily fluids, respiratory droplets, or sores, or through direct contact with shared objects. People can lower their risk of getting infected and spreading the virus by maintaining physical distance from people outside their home. As well, wearing masks, covering coughs and sneezes, and practicing frequent hand washing continues to be important, particularly when in public spaces. Canadians should be aware of the symptoms of monkeypox. Anyone who may come into contact with a case or who is feeling unwell or has symptoms, including skin rash, that may be due to monkeypox, should limit contact with others and report their symptoms to their healthcare provider. Common signs and symptoms include fever, headache, muscle aches, exhaustion, swollen lymph nodes, and development of a new rash. The incubation period for monkeypox is normally 6 to 13 days, but can be as long as 21 days. While the risk of infection is currently low for the general population, monkeypox can affect anyone who is in close contact with an infected person or their contaminated objects. Contrary to some recent media reports, this virus does not discriminate and is not limited to spread from intimate sexual activities. This kind of misinformation and stigmatization can lead to misunderstanding of risks and negative health outcomes. We ask that all healthcare providers in Canada be extra vigilant and closely watch for patients with any symptoms of monkeypox, even atypical presentation, regardless of whether they have reported travel. Following discussions among all the chief medical officers of health in Canada, we have decided to take a targeted approach to vaccination and treatment. At this time, we do not see the need for a mass vaccination campaign, but this situation is under close and constant monitoring and may be adapted as and when the need arises. As such, we have moved quickly to pre-position limited supplies of vaccines and therapeutics from our National Emergency Strategic Stockpile, or NES, in jurisdictions across the country. Quebec has already received a small shipment of the Imvamune vaccine and an antiviral called Tecovirimat, or TPOXX, to support their targeted response. Both of these are authorized by Health Canada. We are also working with other jurisdictions to determine their needs. The Public Health Agency of Canada will continue to work with health authorities and partners in the provinces, territories, and internationally, as well as vaccine manufacturers to respond to the evolving situation. We will provide updates to the public as new emerging information becomes available. Thank you. Merci. Miigwech. Bonjour à toutes et à tous. Je suis accompagné aujourd'hui par le Dr Guillaume Poliquin, le vice-président du Laboratoire national de microbiologie, pour faire le point sur nos efforts visant à traiter les nouveaux cas de variole du singe au Canada. Au cours de la dernière semaine, l'Agence de la santé publique au Canada a confirmé 25 cas de variole du singe au Québec. L'Ontario a maintenant confirmé un cas pour un total de 26 cas confirmés au Canada jusqu'à présent. Nous reconnaissons que l'émergence de la variole du singe serait préoccupante pour les Canadiennes et Canadiens, d'autant plus que la pandémie de COVID-19 est toujours présente. Notre compréhension du virus continue d'évoluer, mais je tiens à souligner qu'il s'agit d'une intervention mondiale. Nous travaillons en étroite collaboration avec nos partenaires internationaux, provinciaux et territoriaux pour assurer la sécurité de la population canadienne. Des cas limités de variole du singe ont été recensés dans d'autres régions du monde par le passé, mais jamais au Canada. Cependant, nous avons une excellente capacité dans l'ensemble du pays pour déceler rapidement et guider notre intervention face à des nouveaux enjeux de sécurité sanitaire. Notre laboratoire national de microbiologie, ou LNM, est reconnu mondialement pour son excellence scientifique. À l'heure actuelle, le LNM met la dernière main au séquençage du génome entier sur des échantillons de variole du singe, ce qui aidera nos experts à comprendre les chaînes de transmission au Canada. Le LNM travaille également activement à faciliter et à appuyer la capacité de dépistage en laboratoire dans les administrations partout au pays. L'Agence collabore avec les experts pour mettre au point et diffuser des lignes directrices en matière de santé publique sur l'identification des cas, la recherche des contacts et l'isolement, ainsi que des lignes directrices sur le contrôle des infections et la prévention pour les systèmes de santé. Comme l'enquête est en cours, des renseignements supplémentaires sont encore nécessaires pour déterminer le degré de risque pour les personnes au Canada. De plus amples renseignements seront disponibles dans les jours et les semaines à venir. Ce que nous savons, c'est qu'il existe différents modes de transmission. La propagation se fait habituellement par contact étroit avec les fluides corporels, les gouttelettes respiratoires ou les plaies d'une personne infectée ou par contact direct avec des objets contaminés. Pour réduire le risque d'infection et de propagation du virus, les gens peuvent maintenir une distance physique des personnes qui ne font pas partie de leur ménage. Aussi, porter un masque, se couvrir la bouche et le nez en cas de toux ou d'éternuement et se laver fréquemment les mains demeurent des pratiques cruciales, surtout dans les endroits publics. Les Canadiennes et les Canadiens devraient se familiariser avec les symptômes de la variole du singe. Toute personne qui a été en contact avec une personne infectée, qui ne se sent pas bien ou qui présente des symptômes, y compris des éruptions cutanées qui pourraient être attribuables à la variole du singe, doit limiter leur contact avec les autres et signaler des symptômes à son fournisseur de soins de santé. Parmi les signes et symptômes courants, notons la fièvre, les maux de tête, les douleurs musculaires, l'épuisement, l'enflure des ganglions lymphatiques et l'apparition de nouvelles éruptions cutanées. L'incubation de la variole du singe est normalement de 6 à 13 jours et peut prendre jusqu'à 21 jours. Pour le moment, le risque d'infection pour la population générale est faible. Le virus responsable de la variole du singe peut atteindre quiconque entre en contact étroit avec une personne infectée ou ses objets contaminés. Contrairement aux propos récents d'un certain média, ce virus ne fait aucune discrimination et ne se transmet pas sexuellement. Ce genre de mésinformation et de stigmatisation peut causer des malentendus, cons au risque et des résultats néfastes en matière de santé. Nous demandons à tous les fournisseurs de soins de santé au Canada de faire preuve d'une vigilance extrême et de surveiller de près tout patient qui présente des symptômes de la variole du singe, même la manifestation atypique des symptômes que le patient ait signalé avoir voyagé ou non. À la suite des discussions entre tous les médecins hygiénistes en chef du Canada, nous avons décidé d'adopter une approche ciblée pour la vaccination et le traitement. À l'heure actuelle, nous ne croyons pas qu'il soit nécessaire de mener une campagne de vaccination de masse, mais la situation est surveillée de près et en continu et des adaptations pourraient être nécessaires. Nous avons donc agi rapidement pour mettre à la disposition des administrations partout au pays des stocks limités de vaccins et des médicaments provenant de la Réserve nationale stratégique d'urgence. Le Québec a déjà reçu une petite quantité de doses de vaccin Imvamune ainsi que d'un médicament antiviral de Ticoviramat ou T-Pox, tous deux homologués par Santé Canada pour appuyer son intervention ciblée. Nous travaillons également avec d'autres administrations afin de déterminer leurs besoins. L'Agence de la santé publique du Canada continuera de travailler avec les autorités sanitaires et des partenaires provinciaux et territoriaux, ainsi qu'avec les fabricants de vaccins pour répondre à l'évolution de cette situation. Nous fournirons des mises à jour au grand public dès que de nouveaux renseignements émergent. Merci. Thank you. Miigwech.
Okay, so we will now move to questions. We will start with Julia Wong.
Hi there. I'm hoping to get a clarification and then my first question. So my clarification is how many doses of the smallpox vaccine were given to Quebec? And then my question is, you talked about pre-positioning vaccine. So will PHAC be sending doses to every province and territory when a suspected case pops up? Like how exactly will that be determined?
Okay, thank you very much for the question. I can confirm that we have shipped a total of 1,000 doses to the province of Quebec in response to their request for the Imvamune vaccine. So it's there for their use, and I understand that they did have a public a press release indicating how they plan to use the vaccine for those at high risk. With respect to other provinces and territories, we are in active discussion with the authorities there. I think the key point to be made there is that we need to ensure that the vaccine can arrive in sort of a short course should the need or demand occur in a specific province or territory based on cases and contexts who are at high risk. So those discussions are ongoing and active, and whether that means pre-positioning in some provinces and territories, or whether that we use our current, I would say, sort of logistical arrangements to ship in a rapid fashion so that those jurisdictions receive it and without any undue delay. That's what's being discussed right now.
And a follow-up question. Does Canada have enough vaccine as it stands right now to respond to the current cases? And how confident are you that Canada will have enough if the crisis gets worse?
Thank you very much for that question. What I would say is that certainly at the present time, it's a small quantity of doses we've given to Quebec. Certainly, there's also a certain supply within our national, strategic stockpile. What I would say is that, as I indicated in my opening remarks, we're not envisaging at this point that it would be a mass vaccination campaign. Based on the evolving epidemiology, certainly it seems to be a very circumscribed and certain, populations with specific, at-risk activities involving close contact. And so it's not something that we're looking at this point to do a mass vaccination campaign. We're also working diligently, with manufacturers and so on to look at assuring that we have sufficient supply moving forward in the future. As you can see, other countries are also moving forward in terms of procurement of, I would say, smallpox vaccine. Obviously, that also has an indication for monkeypox, and primary among those is Imvamune, which has been authorized by Health Canada for both those indications. So, yes, at the present time, it's in hand, but we'll continue to work as needed to make sure that we have sufficient supply as appropriate for the Canadian population.
Okay. Next up, Jacob Serban.
Hello. Can you hear me?
Yes, I can.
I wanted to ask you. You mentioned about sort of stigmatization. Health authorities have indicated that cases are clustered among men who have sex with men. How are you balancing concerns about stigma against the need to communicate the risks that this virus poses to the queer community and to members of this community?
Yeah. Thank you very much. It's a very good question. I would say that, in general, certainly because we know smallpox has been eradicated, since 1980, and people haven't been vaccinated against smallpox, and monkeypox, I guess, being a close cousin of it. It certainly, I think, overall, the whole Canadian population is susceptible to it. In terms of actual risk, as I indicated, there are certain modes of transmission that historically we are using as the base of our sort of our knowledge. Close contact in terms of lesions, with someone who has monkeypox, potentially respiratory droplets and so on. So really, bottom line at this point is anyone who's engaged in close contact, any type of activity with someone who is infected with monkeypox is certainly susceptible to being exposed and getting infected. And that would include, to be honest, sexual activity, because obviously by its nature that involves close contact. So that's, I think, the distinction to be made, that it's close contact of any kind, and that also includes sexual activity. Having said that, we recognize that there is a potential for stigma and discrimination. And so besides, generally indicating to all Canadians, as well as obviously to healthcare providers, that they should be, counseling, and telling people look out for the symptoms, including, unexplained rash and so on, that they also need to be aware that that it's not limited to any specific demographic or group. Having said that, I think we're also alive to the issue that, as you said, that it is at the present time it appears to be circulating in specific communities, and certainly one of our things we're doing is working with the leaders and using other means, maybe with let's say non-governmental organizations, community organizations on the ground, to do a specific outreach to make sure that there's also increased awareness among those who might be at increased risk, be it within a certain community, but also for the population at large.
Thank you.
No follow-up, Jacob?
Yeah, actually, let me ask one more thing. You mentioned that healthcare providers should be on the lookout for atypical symptoms. Is there any sign that there's widespread, or that this disease is not presenting the way that it has presented in the past in previous outbreaks in other countries?
Yes, a very good question. I would say that historically, the cases that have popped up, and certainly, as I mentioned, in Canada, we've never had a case before now. We're considered, I guess, a non-endemic country. That the cases historically have been linked to, quote, travel. Someone who's been in Africa, obviously in a certain context that might have been exposed to the virus, and then bringing it with them back to their home country. But in this situation, certainly we're seeing both in Canada, but also in many other countries around the world, that it's happening in these non-endemic countries, and certainly with individuals who have no travel history or being linked to having recently spent time in Africa. So that's really unusual right off the bat. In addition, in terms of the presentation, certainly in terms of what we've seen from monkeypox in the past, with sort of a generalized rash, maybe on the face and so on, and typically, let's say at least for smallpox, sometimes the rash occurs with sort of all of the pustules sort of at the same stage, all going on at the same time. In this case, what we're hearing from the clinicians on the ground is that some of the individuals don't have sort of that typical presentation. Sometimes they don't have the typical prodrome of a fever. Some have very mild symptoms. The lesions or vesicles might be maybe around the genitals, around the face, maybe not generalized the way it has been maybe for cases in the past, and also that the vesicles might be at sort of different stages, so they're not all sort of similar in terms of how they're presenting to the clinician. So all those things are examples of the kind of data that we continue to need to collect both on the ground, for the individuals, the clinicians who are seeing them, public health, and us at the national level, collecting as much information as we can, and as well connecting with our international colleagues. We all need to be learning about the change in how this virus is evolving around the world, so that we can all then react appropriately.
Thank you.
Okay, so that was the last question. Unless anyone else has a question, we'll just end it there. Oh, we have one more question. James Mackin. Go ahead.
Yeah. Hello, can you hear me, Dr. New?
Yes, I can.
Sounds good. Thank you for taking my question. I was wondering if you could tell me a little bit more about T-pox. Is that something that you would take in conjunction with the vaccine, or would that be a medicine you could take instead of the vaccine?
Thank you very much for the question. Just to be clear in terms of authorization, the vaccine is the one that is, quote, officially, I would say approved by Health Canada for use for monkeypox. The T-pox as an antiviral at this point, is approved, but it's more specifically for smallpox. But it could be used, as they say, off-label for monkeypox. Having said that, the vaccine is not primarily for those who already obviously have monkeypox, but it's more looking at what could be done for those in terms of pre-exposure, or in this case possibly post-exposure, shortly after being identified as a contact of someone with monkeypox. So that is really the indication for the vaccine as well. But for the antiviral T-pox, it's more in terms of using it for the treatment of the individual who is the case of monkeypox, in terms of mitigating against some more severe consequences. And that really is at this point a matter of clinical judgment for the clinician that's dealing with the individual as monkeypox.
Okay, thank you. My second question was, is Health Canada currently concerned about this potentially spreading to the point of an epidemic or pandemic?
Well, we're always, monitoring the situation, obviously, at both local, provincial, and here at national level. At this point, certainly based on what we've seen to date with the epidemiology, it seems to be confined in certain individuals who obviously haven't engaged in activities involving close contact, but there doesn't seem to be any evidence of what I call a more generalized spread to the community. If you're indicating how does this compare to COVID-19, I would say no, it's not as easily transmissible as COVID-19, where we know it's spread through the air and aerosols. In this case, it really seems to be at the present time focused more on individuals who've had close contact with each other, especially with those who obviously have monkeypox and then transmitting it to others. So at this point, it's still something that we're monitoring closely, but we don't want to be complacent. We need to learn more about this virus and what's happening with the epidemiology to be able to obviously adapt our control strategies as appropriate.
Okay, thank you very much, Dr. New.
Il ne semble pas y avoir d'autres questions, donc c'est ce qui met fin à la conférence de presse. Thank you, everyone. Merci, Monsieur New. À bientôt.
Okay, merci.
Recording stopped.